Lower back pain affects 4 out of every 5 people, and statistically speaking, 30% of those 4 are experiencing sacroiliac joint pain. Welcome to this new 5-part video series on how we can remedy sacroiliac joint pain. Part 1 follows now. Hi, I'm Adam Cox and welcome to this brand new 5-part series on the sacroiliac joint. In part 1 we're going to look at what the sacroiliac joint is and how to assess it at home on yourself. Part 2 we're going to look at stretches and mobilizations that we need to start to incorporate into our exercise regime. Part 3 we'll look at some exercises to stabilize the joint. Part 4 we're going to look at what movements are perhaps undermining our efforts so far and causing us to destabilize the joint, and part 5 we're going to look at some lifestyle issues that again will undermine our efforts. Before we get into that, if you haven't already, please subscribe to our channel. There'll be free weekly content coming up. So let's get into part 1. So first and foremost, before we start to look at anything else, we need to understand what the sacroiliac joint is. If you're not sure already, the sacrum is basically the muscle, that's a good start. It's the bone that sits at the base of the spine, and the ilium is part of, or half of the pelvis that sits next to the sacrum, and those two joint surfaces are called the sacroiliac joint, so where they meet. And we can get problems in there when the joint either moves too much and we become hypermobile, or when it doesn't move quite enough, we become hypomobile in that area. And that can lead to a whole host of issues. Disc-related spinal challenges can be one of the things that actually stems from a sacroiliac joint problem in the longer term. So if we keep that in mind when we're looking at all of the rest of this video series, that's what the sacroiliac joint is. So when you're experiencing that pain, you very likely, if you are someone that does suffer with that, you can connect with the fact that that is where you're experiencing your lower back pain. It can also refer out into the hip, further up into the back, and actually come through onto the front of the hip here. So just bear that in mind. So we want to look at one main system before we go any further, and that is what we call the nutcracker effect. Okay, so the nutcracker effect is one of the systems that should be helping you stabilize the sacroiliac joint, and that is the transverse abdominis, that is the large, deep abdominal muscle that comes all the way round and attaches into an area of the lower back called the thoracolumbar fascia. The nutcracker effect is when that transverse abdominis muscle actually pulls or contracts and pulls the two halves of the pelvis, what I called the ilium earlier. So the two sides of the pelvis are called the ilium, or the iliac crest. When the transverse abdominis contracts, it actually pulls those two, and what we call forced closure occurs on the sacrum. So that means that it's closing the sacroiliac joint or stabilizing it. So the nutcracker effect is that it's stabilizing the sacroiliac joint. Okay, the problems occur when we have bloating, distension, or the transverse abdominis just doesn't work effectively enough, and so this closure of the sacroiliac joint is not happening. And that's when we can get too much movement through the joint and get all sorts of issues and pain. So we're going to go through a test for that. So what you need is a piece of string, and we're going to take this piece of string and we're going to take it round the middle of the body, and we're going to tie it at belly button level. Okay, before we do that, we want to take a nice deep breath in, breathe out, and draw the belly button in gently towards the spine. Now just take that string and tie it so that it's flush with the skin whilst the belly button's drawn gently towards the spine, but it's not causing marks on the skin and cutting into you too tightly. So the test that we do is we want to perform a forward bend with the string attached to the abdomen like that. Now, as we bend forwards with the string around the abdomen, what we might find is that as you get to about this point here and further, you either feel that the belly button draws in and we get actually more of a gap between the string and the abdomen, or just the skin, or the belly will actually move forwards and out into the string and you feel it become much tighter. Okay, if it's the latter and the string's becoming tighter and actually cutting into you, this is an indication that we've got a problem with that nutcracker effect. So instead of the transverse abdominis pulling the abdomen, the rest of the abdomen in and stabilizing the sacroiliac joint in that particular capacity, it's not doing that, and we've actually got other muscles at play causing a bit of a problem with the stability through there. So that's the nutcracker effect, and this is a very, very simple test that you can do with a piece of string. So wrap it around, draw the belly button in, tie it so that it's flush, and then bending forwards. If we feel that the string pulls tighter, or we feel that the belly pushes into that string and doesn't actually get looser as we bend forwards, that's one indication that we've got a slight problem with that nutcracker effect. Okay, so the second system that we're going to address is the lateral system. Okay, this is a series of muscles that helps to stabilize us when we're standing on one leg. So for example, if we're walking, we're obviously on one leg most of the time, and we need the muscles of the standing leg and of the trunk on the opposite side to help stabilize us. So we're going to be assessing three muscles. We're going to assess the gluteus medius, the adductors on the same side leg, and then the quadratus lumborum on the opposite side. So to do that, we're going to look at the toe touch drill as our assessment. So let's have a look at how we're going to do that now. So the toe touch drill, if we start standing on one leg, you're going to imagine that you're in the middle of a clock face, and the leg that's moving around the body is just tapping each number as you go around. What we're actually looking for though is what's happening on the stance leg. So what's happening with the knee and what's happening in the hip, specifically with the right leg in this particular instance. So is the knee staying in line with the second toe? Is it tracking properly? Or is it falling in or out? As you can see here, if my upper body starts to roll side to side, I lose the knee either inward or outward, or the hip drops like this, then this is a fail in the toe touch drill. So just to recap, what it should look like is what it's happening on the left leg here. The knee stays in line with the second toe, the hips stay level, and that is a passing grade on the toe touch drill. So have an assessment of this toe touch drill and see how you get on. So thank you very much for watching part one. Please let us know in the comments below if you've got any questions with those tests. Hopefully you go and perform those tests now and find out whether the nutcracker effect and the lateral sling or lateral system is working effectively, and then stay tuned for part two, which is coming, and we're going to look at the stretches and mobilizations that you need to start improving the function of your sacroiliac joint. If you haven't already, also please subscribe to the channel, and we'll see you soon. Thank you.